Good morning. I am Mrs.Girijabhaskaran, Professor, Department of Medical Surgical Nursing. Presently, I am working in Epidemiology College of Nursing. I am going to discuss about diabetes mellitus. Before that, I want to give introduction about diabetes mellitus. Diabetes was described as the passing of large amounts of sweet urine. This was described in BC, 1500 BC. The name diabetes to pass through, that means that to pass through, was given in AD 200 by a great physician. Athens. Later, mellitus means sweetens, was added. In 1921, insulin discovered by Doctors Banting and West, before which diabetes patients used to die of ketoacidosis. That time they were used in oral hypoglycemic agents in the year 1950. As per experts today, we have about 30 million people suffering from diabetes in India. This number is expected to increase to more than 50 million by 2025. Diabetes mellitus is a group of metabolic diseases in which are high blood sugar levels over a prolonged period. Diabetes is due to either the pancreas not responding enough insulin secretion or the cells of the body not responding properly to the insulin produced. If untreated, diabetes can cause many complications. Let us see the definition of diabetes mellitus. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and lungs. This definition was given by the World Health Organization. This slide shows the epidemiology of diabetes mellitus. It is uncommon in infants, increase in frequency until adolescence and then drops sharply. It has two definite peaks, one at about 5 years and the other about 10 to 12 years. Seasonal variation has also been noted with children being diagnosed more often in winter than summer months. Diabetes mellitus is found most frequently in persons over 40 years of age who are obese and who have a family history of diabetes. This slide shows the major types of diabetes mellitus. There are three main types of diabetes mellitus. One is type 1, type 2, another one is gestational diabetes. Type 1 diabetes, it results from the pancreas failure to produce enough insulin. This form was previously referred to as insulin-dependent diabetes mellitus or juvenile diabetes. Type 2 diabetes begins with insulin resistance, a condition in which cells to fail to respond to insulin properly, previously referred as non-insulin diabetes mellitus. One more type is there, that is gestational diabetes. Third main form and occurs in pregnant women without previous history of diabetes. This slide explains the comparison of type 1, type 2 diabetes. What are the things here we are going to compare? That is features, onset, age at onset, autoantibodies, endogenous insulin, body size, and ketoacidosis. Let us see one by one. Onset. The onset is sudden in type 1 diabetes. In type 2 diabetes, it is gradual. Age at onset, mostly in children. Type 1 diabetes, that is mostly in children. Type 2 diabetes, that is mostly in adults. Autoantibodies, usually present in type 1 diabetes, usually absent in type 2 diabetes. Endogenous insulin, this may low or present in type 1 diabetes. In type 2 diabetes, it is decreased or increased. Sometimes it is normal. Body size. This will affect mainly thin or normal body size. Type 2 diabetes mostly affect the obese person. Ketoacidosis, it is more common in type 1 diabetes. It is very rare in type 2 diabetes. Let us see the pathophysiology of diabetes mellitus. The body obtains glucose from three main places. One is the intestinal absorption of food. The second is the breakdown of glycogen, the storage of form of glucose found in the liver. Gluconeogenesis is the generation of glucose from non-carbohydrate substance in the body. Here, insulin plays a critical role in balancing glucose levels in the body. Insulin can inhibit the breakdown of glycogen or the process of gluconeogenesis. And also, it stimulates the transport of glucose into fat and muscle cells. Also, it can stimulate the storage of glucose in the form of glycogen. Insulin is released into the body by beta cells found in the islets of Langerhans in the pancreas. Where the insulin is released in the beta cells of the Langerhans, islets of Langerhans, it is present in the pancreas. What is happening in the diabetes mellitus? If the amount of insulin available is insufficient, or the cells respond poorly to the effects of insulin, or if the insulin itself defective leads to glucose will not absorb properly by the body cells. The effect is persistently high levels of blood glucose, poor protein synthesis, and breakdown of fat storage. This referred as acidosis. When the glucose concentration in the blood remains high, the kidney will reach a threshold of reabsorption that leads to glycosuria. This increases the osmotic pressure of the urine, leads to polyuria. Lost blood volume will be replaced osmotically from the water held in body cells and other body components. That leads to dehydration. This will exhibit in the form of polydipsia. Type 1 diabetes mellitus. By the loss of insulin secretion and beta cells of the islets of Langerhans in pancreas, leading to insulin deficiency. Type 1 diabetes mainly due to insulin deficiency. The majority of type 1 diabetes is the immune-mediated nature, in which a T cell mediated autoimmune attack leads to the loss of beta cells and the insulin. Among dietary factors, gluten may lead to type 1 diabetes, but mechanism is not fully understood. This is the causes of diabetes mellitus. Type 2 diabetes is due to lifestyle factor and genetics, and also obesity, lack of physical activity, poor diet, and stress. In GDM, a combination of relatively inadequate insulin secretion and responsiveness. GDM is truly treatable but requires careful medical supervision throughout pregnancy. Untreated gestational diabetes can damage the health of the fetus. Let us discuss the signs and symptoms. The classic symptoms of untreated diabetes are weight loss, polyuria, polydipsia, polyphagia. Other signs and symptoms: blurry vision, headache, fatigue, slow healing of cuts, itchy skin, skin rashes, prolonged high blood glucose. These are the signs and symptoms of diabetes mellitus. Let us see the diagnostic procedures. Under diagnostic procedures, we have so many headaches. First, we'll see the health history. The health history includes that is the family history, personal medical history, that too past, present, and present medical history, past surgical history and past present surgical history. Apart from that, we have to collect is there any family history of diabetes mellitus, like this kind of diseases, and then we have to get history of personal history that includes the hobbies and then the habits and food style and that activities and then elimination, everything it includes in the personal history. After collecting the history, we will go for physical examination. Under physical examination, we are doing head to foot assessment. In head to foot assessment, we are observing what are the previous slide, what are the signs and symptoms of diabetes mellitus. We can uh, find out through this physical examination. Apart from this physical examination, we will do it the endocrinal assessment. Under this assessment, inspection, palpation, percussion, and auscultation. By using these methods, we can find out is there any abnormality in that particularly in the abdominal cavity and then the lower extremities. After doing this physical examination, we are advised the patient to take fasting blood sugar and then postprandial blood sugar and then HbA1c. This gives the that is total 6 months report of blood sugar level and then lipid profile. It gives the HDL and LDL and triglycerides values and then we are advising the patient to do urine analysis. These are the commonest diagnostic procedures to confirm the diabetes mellitus. Next, we will move on to management of diabetes mellitus. Here, I have given 5 headings. Under the 5 headings, this 5 areas we are mainly focused on the management, controlling the or treating the diabetes mellitus. And what are the areas we are focusing on? Diet and exercise, oral hypoglycemic therapy, insulin therapy, food care, and follow-up. Let us see in detail of insulin therapy. Here, I have mentioned what are the principles of insulin therapy and how to monitor the same. First, elimination of clinical features of uncontrolled diabetes. And then, prevention of diabetic ketoacidosis. By giving insulin, we can control the blood sugar level, high blood sugar level, and then through that we can prevent the diabetic ketoacidosis. Avoidance of hypoglycemia, maintenance of normal growth and maturation, and then early detection of associated diseases. Because this disease, if it is not untreated, this may cause many complications. Early detection, by means of early detection, we can find out the associated diseases. And then prevention of emotional disorders. And prevention of chronic vascular complication of diabetes. Insulin is formed from a substance called proinsulin. The increased blood glucose level stimulation the proinsulin to insulin and connecting peptide and enter the bloodstream. Insulin is produced in 2 phases. First phase, immediately after the glucose stimulates, this insulin is already produced in the pancreas and stored. Pancreas can store 2,000 of insulin at a time. Second phase produce as per future treatments. Here we are going to see the functions of insulin. Certain amount of insulin readily circulate in the blood, which is called the basal insulin. Insulin enhances fat storage and prevent fat mobilization for energy. Insulin stimulates glucose transporters to enable entry of glucose into cell for utilization as energy source. Insulin promotes glucose storage in liver and muscle as glycogen. This slide explains the types of insulin. Insulin can be categorized under the following species, that is source of insulin, based on the duration of action of insulin, purity of insulin, concentration of insulin, trade names of insulin. Under source and impurity, we have here beef insulin, human biosynthetic, pork insulin, beef, pork, combination of insulin. Duration of action, how long that insulin react. Insulin are categorized as per duration of action as under short acting, intermediate acting insulin, long acting insulin, biphasic insulin. Methods of delivery of insulin. How can we inject the insulin? By using, we can inject syringe. Syringe we can use to deliver the insulin. And then pen, that is, it's a preloaded insulin. We can use it to deliver the insulin. Pump here we are using for continuous infusion. While using pump, we have to dilute the insulin. Here the measurements is given 50 units, that is 5 ml on 49.5 ml of normal swelling. Each ml consists of 1. Text management. So far we discussed about the insulin therapy, how it reacts and what are the types of insulin available, how we are, the method of delivery system that we have discussed in the previous slide. Now, in this slide, we are going to see the exercise in diabetes management. Regular controlled exercise has a very important role to play in diabetes management. Exercise has the potential to control diabetes through non-medical means, reduce the severity of disease, and significantly reduce the risk of long-term complications. A continuation of exercise, types of exercise. What are the exercise we can advise the person for diabetes mellitus? Aerobic exercise. Under aerobic exercise, what are the things, movements we can do it? Dancing, swimming, or water exercise, playing tennis, stationary bicycle, indoors. And strength, training, but weight and elastic bands. Flexibility exercise, walking and swimming. Exercise intensity and frequency and duration. The intensity, how the intensity should be low to moderate. Frequency, how often I have to, that means a diabetic patient has to do the exercise. That is the frequency. For IDDM, insulin dependent diabetes mellitus, 5 to 7 days a week they can do the exercise. For non-IDDM, non-insulin dependent diabetes mellitus, 4 to 5 days a week. Duration, how long, how the duration, the time for IDDM, insulin dependent diabetes mellitus, 20 to 30 minutes per session is advisable, and for non-insulin diabetes mellitus, 40 to 60 minutes is advisable per session. Now we'll see the dietary guidelines of diabetes mellitus. What are the diets we can take and what should be avoided? First of all, we list of what are the foods we can refer to the diabetes patient. Maintain ideal body weight. Body weight is important in diabetes mellitus because in the first slide itself I explained the body weight also the factor considered for developing diabetes mellitus. Here, that's why particularly we insisted maintain ideal body weight. For maintaining on the ideal body weight, what are the things you have to do? Choose simple carbohydrates, protein from vegetarian sources, restriction on fats and oils, increase in fiber in diet salads, add salad, whole pulses, whole cereals, and sprouts in meal. Fixed meal times. Timings, avoid skipping meals or fasting. Go for smaller meals. The continuation of dietary management are advised to take other vegetables also, like green leafy vegetables, high fiber foods, spices, buttermilk, and lemon. Black drinks under that is drinking items, we can advise the patient to take black coffee, tea without sugar, cereals, pulses, and roots and tubers, and fruits, milk products that are skimmed milk. Fruits are also non-sweet variety, we can advise them to take, and eggs. This slide explains special foods for diabetes mellitus. Salad dressing, bitter gourd, fenugreek seeds, amla, amun, ragi, and diabetic atta. And these all commercially available in the shops. We buy it in the market. The diabetic atta, and wheat flour, gram flour, and soya flour. Foods should be avoided. What are the foods that should be avoided by the diabetes patient? Sweets, sugar, honey, jam, jellies, cakes, pastries, soft drinks, fried food, mango, banana, grapes, chiku, dry fruits, and sweetened juices. This is about the dietary management of diabetes mellitus. Under management, we have pharmacological and non-pharmacological management of diabetes mellitus. Insulin therapy and other drugs, diabetic drugs, anti-diabetic drugs, metformin, these are all comes under the pharmacological management. Under non-pharmacological, we mainly insist on the exercise and foods. And then follow-up. Follow-up is very, very important for diabetes patient to prevent the complication and also to detect the complications of like foot ulcers and other things, other associated diseases. And then follow up is important, and then to control the blood sugar is very, very important to prevent complication. These are not included in the management. Let us see the complication of diabetes mellitus. Acute complications, and under the setting we have acute complication and chronic complications. Let us see the acute complications. One is ketoacidosis, and then hyperglycemic and hyperosmolar non-ketotic syndrome and hypoglycemia. Under chronic complication, disorders of microcirculation, neuropathies, nephropathies, retinopathies, macrovascular complication, and foot ulcer. That's all about the complications of diabetes mellitus. Now let's see, being a nursing students, we must know what are the nursing diagnoses. We can use it for this diabetics while caring the diabetic patients. Under nursing diagnosis, I have listed out four things. Mainly I focus on four nursing diagnosis. One is anxiety and fear, then imbalance nutrition, pain, fluid volume deficit. Why I put this anxiety and fear? Because the diabetes mellitus itself be a chronic disorders. Once the patient exhibits the symptoms of diabetes mellitus, they will have fear about that disease. They develop anxiety because of this disease, because they doesn't know about that in diabetes mellitus. That is the thing. I put anxiety and fear. That is also leads to increased blood sugar. To avoid that, we have to counsel the patient, give adequate knowledge to the patient, and this can be preventable and this can be controllable. This assurance must be given to the patient. Next one is imbalanced nutrition, because in dietary management, we explain what are the food they have to take and what are the food they should not take. Here, they have to balance because they should not take high carbohydrate diet. If they have high carbohydrate diet, definitely their blood glucose level will be increased. To avoid that, we are advising them to take low carbohydrate, high fiber diet, and low fat diet. And then sometimes they due to this macro and microvasculopathy, the patient will have pricking pain in the fluid centers. Fluid volume deficit. Fluid volume deficit. The patient will complain, I'm passing urine for so many times. This will leads to dehydration. This can be compensated by taking adequate food. That is the thing here I have mentioned for nursing diagnosis. This is the present, based on the present complaints, I have selected this nursing diagnosis. Potential self-care deficit related to physical or impairments or social factors. Because if they are not controlling their blood sugar level, they will go for, definitely they will fall into some complications. That's when that time they need someone's help. Okay, this is the potential. This can be expected in future. That's why it's a potential nursing diagnosis. Knowledge deficit related to care of a child with newly diagnosed diabetes mellitus, and also not only child, when they adult also have this difficulties. Fear and anxiety related to long-term illness and complications. Definitely they will have fear about the complications. This can be controlled or this can be relieved by giving proper counseling. So far, I discussed about the introduction about diabetes mellitus, definition, causes, and then pathophysiology, signs and symptoms of diabetes mellitus, and diet management and the nursing management.